Pharmacy exam multiple choice questions with their answers. Which of the following would be an appropriate counseling point for a female purchasing intravaginal meconiazole? Options are avoid treatment during menstruation, all male partners should be treated, avoid concomitant use of external creams, side effects can include burning or irritation. Here the answer is option D. That is, the intravaginal treatment for vulvovaginal candidiasis can be used during menstruation and can be used in combination with external creams. It is not necessary for male partners to be treated. Side effects can include burning or irritation. Next one, a 30-year-old female is 10 weeks pregnant with her second child. During her first pregnancy, she became depressed and was started on Prozac 20 mg every day. Prozac is the brand name for fluoxetine. She is already beginning to notice early symptoms of depression during her second pregnancy. She would like to try St. John's wort for her depression. Which of the following statements is correct regarding St. John's wort? Options are the safety of St. John's wort in pregnancy is unknown. St. John's wort is not helpful in treating mild depression. St. John's wort may interact with serotonin reuptake inhibitors. St. John's wort may interact with dairy products like milk and eggs. St. John's wort decreases the effects of clopidogrel. The brand name is Plavix. So here the answer is option C. That is, the statement which is correct regarding St. John's wort is option C. That is, St. John's wort may interact with serotonin reuptake inhibitors. St. John's wort is indicated by Commission E for depression and anxiety. St. John's wort should be avoided in pregnancy because it is an emmenagogue and abortifacient. And this St. John's wort interacts with many medications including serotonin reuptake inhibitors. It may interact with clopidogrel by increasing its antiplatelet effects. Food interactions may be similar to those of the MAVO inhibitors, such as tyramine containing foods like cheese, beer, wine, herring, and yeast. AH is a 1.2 kg female born prematurely at 30 weeks of gestational age. Her mother had an infection with a fever at the time of delivery. AH was admitted to the neonatal intensive care unit for presumed sepsis and placed on empiric antibiotic therapy with ampicillin 50 mg per kilogram IV every 12 hours and gentamicin 2.5 mg per kilogram IV every 8 hours. After the administration of 4 doses of gentamicin, a serum concentration obtained 5 minutes before the next dose was 2.5 microgram per ml. Which of the following answers best describes the pharmacokinetic differences observed in premature neonates compared to older children and adults that might explain this value? Options are larger volume of distribution, longer half-life, larger volume of distribution, shorter half-life, smaller volume of distribution, longer half-life, smaller volume of distribution, shorter half-life, similar volume of distribution, shorter half-life. So here the answer is option A, that is larger volume of distribution and longer half-life. Aminoglycosides such as gentamicin exhibit a larger volume of distribution in neonates because of their larger body water content. Neonates also typically have a longer elimination half-life as a result of having reduced renal function during the first 6 months of life. So this is a continuation of the question that we have discussed in the previous slide. That is, ampicillin may exhibit pharmacokinetic differences in AH because of its protein binding characteristics. Which of the following answers best describes the effect of AH on ampicillin protein binding? Options are increased protein binding resulting in a greater free fraction, increased protein binding resulting in a reduced free fraction, decreased protein binding resulting in a greater free fraction, decreased protein binding resulting in a reduced free fraction, decreased protein binding resulting in no significant change in free fraction. So the answer is option C, that is decreased protein binding resulting in a greater free fraction. This is because neonates have both a reduced quantity of plasma proteins as well as a reduction in the affinity of albumin to bind to other substances. As a result, the free fraction of many drugs including ampicillin is increased. So this is also a continuation of the previous question. That is, as the pharmacist providing services for the neonatal intensive care unit You evaluate medication orders and make recommendations to the medical team. Which of the following would be the most appropriate recommendation for AIDS care? Options are changed to oral antibiotics for better absorption. Double check the calculations to avoid decimal errors. Dilute the gentamicin with a larger volume of IV fluids to make it easier to measure. Use a pediatric specific therapeutic range for monitoring gentamicin. Change to sulfamethoxazole and trimethoprim. The brand name is Bactrim for single agent antibacterial coverage. So the answer is option B. That is, double check the calculations to avoid decimal errors. All pediatric orders should be carefully checked for calculation errors. Errors are more common in the pediatric population as a result of weight-based dosing and the need for mathematical calculations. The use of the oral route would not be advisable in this patient because of the potential reduced drug absorption. Likewise, the dilution of the dose with more IV fluid or the use of a sulfur drug would not be appropriate for this patient's age. Finally, the therapeutic range for gentamicin is the same in pediatric patients as in adults.